So I'm Miles, I'm the Senior Psychologist at Scottish Brain Sciences, and I'm going to talk a bit about how we applied the things John just spoke about, but to the Iona cohort. So our approach to choosing the memory and thinking assessments that we use was guided by our aim to tap into all the essential parts of cognition that John spoke about there, and have a particular focus on those that are kind of likely to be in the kind of early phases for reasons that Craig spoke about earlier. So we included a variety of assessments, both kind of validated measures that are used globally around the world in clinical and research settings, and also some more kind of experimental ones, which we've cherry-picked because we think are really good at picking up on kind of subtle, small changes earlier in the disease process. So in addition to looking at all these kind of essential parts of cognition, we also considered simplicity and reducing participant burden as a really important factor. If you've ever taken part, as I know a lot of people have here in cognitive testing, a lot of it is really difficult. And the reason it's so difficult is because if everyone is getting 100%, it would tell us very little. And particularly for a kind of midlife, early phase where we're trying to look at these kind of subtle changes, the bar needs to be quite high, hence it needs to be quite difficult. The downside to this is obviously if you're doing hours upon hours of difficult assessments, that can be quite draining, and with fatigue, that is going to be less accurate of your actual cognitive ability. So with this in mind, we tried to get a kind of good balance between being participant-friendly and making sure everyone's having a good time, but also gathering all the information we really need to get. And we think we found a really good balance of that. So the measures we included, like the thermometer, are valid, reliable, and sensitive to early changes. And I won't detail them all here, because that would be spoilers for those who haven't seen them yet, but they include things like mental calculations, remembering lists of words, and deciphering codes, and that sort of thing. In addition to these kind of objective measures, we also do more discussion-based assessments. And this is where we ask you, the participant, for your own insights into how you think things are changing, specifically in memory and thinking, but also just in every aspect of your life. So if you've always been really good at something and you've started to notice a small change, then that's something we'll kind of take note of. And this is where your study partner, which Sarah mentioned earlier, comes in. So this is someone that knows you well enough to be able to answer a few questions about you, but also know how you are when you go to the shops, do the gardening, your hobbies and these types of things. So we'll talk to you individually and get a kind of all-round insight into how you are in day-to-day life. And by having that and also the objective tasks, we kind of look into your cognition from both angles. In addition to the cognitive assessments, we also do a series of questionnaires, which has been touched upon. We look at a few different things, particularly kind of lifestyle factors. So I'll mention a few of them here. Diet, and in particular the Mediterranean diet, which you may have seen on the news as being associated with brain health. We also look at sleep, and specifically sleep quality, which can be related to brain health risk over time. Yes, so we also look at kind of psychological well-being, so anxiety, stress, what was the other one? Depression, which can be risk factors for things like dementia, but also can be as a result of something like dementia. So we like to get an insight into that there as well. And also things like neuropsychiatric symptoms, so hallucinations, delusions. And when we have these kind of questionnaires as well as the memory and thinking tasks, and we're repeating it every year, as well as everything else on the Iona study, it allows us to build up these kind of trajectories of change over time. So we can see if there are any changes, specifically where those changes are, or there may be consistency. And on a kind of grander scale, when everyone's taking part, we're able to see the kind of common denominators and common themes that are coming out of that. And the final thing I'm going to talk about is something that we're having a look at recently, which is the possibility of doing some of the cognitive assessments, maybe some of the questionnaires, and maybe some other things on the Iona study remotely, which has obviously become a bigger thing since lockdown with Zoom and Teams and that sort of thing. There's a few benefits that I think this could bring. First, improved accessibility. So Scotland's a really good example of a place where if you live in the Highlands and Islands, it's very hard to get to a central hub like Edinburgh. So if we can do some of the things, at least now, online, then it could help people who wouldn't otherwise take part in research be able to take part in research. So as an example of this, I have family on Tiree, on the west coast, 5-hour ferry to get to the mainland, plus 2.5-hour drive, plus snack breaks to get to where we are. So if we can offer some of it and allow people who wouldn't normally take part in this research, that could be really valuable and get a better representation of the Scottish population. Tied to this is inclusivity to people who, if we're looking at kind of a midlife range, people who may not necessarily be retired, if we can offer some things a bit more flexible and do some things remote, this could be a real draw for people who, again, we wouldn't otherwise be able to get to come to us and take part in the research. And finally, financially, it could make more sense in terms of travel expenses, although we do reimburse those on Iona. But in terms of things like pet cover and child cover, if you can do some of the things online, it could help reduce that, as well as the kind of environmental burden of having more travel. So with these benefits in mind, we're kind of working potentially towards a kind of hybrid model, or at least looking at the feasibility of it and offering some things online to people who would want that. So we're doing a little sub-study to investigate this further. So watch this space. And on that note, I'll pass over to Dr. Alison Green. Thank you very much.